and a warm welcome back to the channel. Vibrant despite cancer. This is your channel, this is our channel, and if you are undergoing cancer treatment or if you know anybody who is undergoing cancer treatment, this is your channel. Come on board and join us. If you are undergoing surgeries like I did, or radiations like I did, or hormone treatment like I am doing for the last 20 months, or chemotherapy, on this channel we are talking about how to improve our quality of life, how to make every moment better, how to maximize our energy and minimize the side effects. It's a beautiful day here in the Rockies. We went for a long hike and we are feeling great. In the course of the last few programs or on this channel, you know that we've spoken in depth about the extraordinary importance of exercise during cancer treatment. Sleep and exercise, we spoke about sleep on the last video. So sleep and exercise are partners in recovery and they reinforce each other very powerfully. Exercise improves sleep quality. Regular, moderate exercise is one of the most effective non-pharmaceutical intervention for improving sleep quality in us cancer patients. Research show that deep sleep increases the proportion of short-wave sleeps, the most physically restorative stage of sleep. People who exercise regularly spend more time in the stages where cellular repair and immune function peaks. We know that all of us undergoing cancer treatment sometimes have problems sleeping, falling asleep, staying asleep, and indeed it's a very critical subject for all of us. I sometimes myself still wake up at 3 in the morning and I can't go back to sleep for an hour or two. Aerobic exercise reduces the time it takes to fall asleep and reduces nighttime waking. I notice that when I exercise a bit intensively during the day and I'm really tired at night, I do sleep better and more deeply. Even a single moderate workout can improve the night sleep. Of course, we have anxiety when we are undergoing cancer treatments, and exercise reduces anxiety and depressive symptoms. Two of the primary psychological drivers of insomnia are anxiety and depressive symptoms. Exercise helps regulate cortisol, the body's primary stress hormone. So when cortisol is better regulated, the natural rise and fall that governs sleep-wake cycles, as we saw on the last video, becomes more consistent. And sleep improves exercise recovery. So sleep and exercise go hand in hand. They support each other. The other direction of this relationship is important. Sleep is where exercise adaptations are built. The muscle proteins, the process by which your muscles grow stronger, the protein synthesis, and this process occurs primarily during deep sleep. The workout creates the stimulus, and sleep delivers the adaptation. Energy restoration, the body's stored form of carbohydrate, which is the primary fuel for exercise, is replenished most efficiently during sleep. Of course, exercise is important in terms of motor skills improvement, coordination, balance, motor learning. All are important during cancer rehabilitations, and they are consolidated and improved during the REM phase of sleep. We saw this in a previous video about the three phases of sleep, REM being one of the critical ones. Injury prevention is important as well. Injury risk is significantly higher with poor sleep. Studies show that athletes sleeping fewer than 8 hours are twice as likely to be injured. So, for someone managing treatment side effects like us, avoiding additional setbacks is critically important. So, practically, exercise at moderate intensity on most days, earlier in the day rather than later in the day, whenever possible, and trust that your sleep will both support and be supported by your movement practice. So, of course, cancer patients, as I said, we all struggle with sleep. It's not our fault. We are not guilty of anything. It's just the nature of the beast. And if you are having difficulty sleeping, you are not alone. You are not doing anything wrong. And it is not a sign of weakness. They are powerful, well understood reasons for which sleep becomes disrupted during cancer treatment. Sometimes we have pain and discomfort from surgery. We have joint pain or skin sensitivity from radiation, which can make it difficult to find a comfortable position. Medications, some hormone therapies. And again, I know about hormone therapies after 20 months of being on them, are activating the nervous system and they can disrupt our sleep in a big way. And of course, anxiety about diagnosis, outcome, family, finance. Personally, I have my monthly blood test to make sure that nothing is out of whack, and I'm really anxious 2 or 3 days before to check the result of my blood test. All of those are disruptors, and the mind races when the body has a challenge becoming still. Hot flashes, night sweats. Many of us have that. I have a lot of hot flashes and night sweats because of the hormone treatments, and they are cause of repeated nighttime awakening. Daytime napping can be helpful. I find that if I take a nap, even for 10 or 15 minutes during the day, my body relaxes. I am more quiet and I sleep better at night. So, understanding why sleep is disrupted is the first step towards doing something about it. Poor sleep during treatment is common, but it is not inevitable and not permanent. We spoke about purely sleep on the last video, about sleep and exercise on this one today. We will talk about sleep hygiene and sleep and nutrition, the interaction between nutrition and sleep on the next video in a few days. In the meantime, of course, I wish you the best. And remember that you are like a candle. You can light up many more candles without losing any of your own brightness. So I wish you health and happiness. Until next time, thank you.